Namaste. I am Dr. Samir Tawakley. I am a senior consultant nephrologist at Apollo Hospital, Noida. Greetings on this World Kidney Day. This Kidney Day is celebrated all across the globe on the second Thursday of March of every year. Every year, this World Kidney Day has a different theme to create awareness and knowledge about kidney diseases. This year, the aim or the theme of World Kidney Day is advancing equitable access to care and optimal medication practice. As you all know, kidneys are very important organs of our body. They are associated with mainly the excretion of waste products in the form of urine and also maintaining the acid base and electrolyte balance of our body. They help in maintenance of bone health as well as synthesis of a hormone by the name of erythropoietin, which is important to maintain the hemoglobin in our body. So, kidneys not only serve important functions in maintaining the acid base milieu of the body, but also help in cleansing the body. Whenever there is any kind of an abnormality in the functioning of the kidney, this leads to kidney disease, which may be either acute or chronic in nature. Acute kidney disease is generally sudden in onset but reversible in most of the circumstances. Chronic kidney disease is a long term affection of the disease extending for more than 3 months duration and usually irreversible. There is a lot of morbidity and mortality associated with this disease, and in fact, at present, it is the eighth leading cause of death amongst all the diseases worldwide. And by 2040, it is projected that it will become the fifth leading cause of loss of life because of diseases. Earlier, most of the strategies were implemented towards educating and preparing the patient suffering from chronic kidney disease in order to maintain their quality of life and also longevity by providing them renal replacement therapy. But with modern technology and modern advancement in medicines, now this shift is towards providing medications which can either prevent or delay the progression of disease, thereby maintaining a good, healthy lifestyle for most of these patients. But still, there are a lot of inequalities in terms of availability of treatment strategies, in terms of development of medications in various regions of the world, and also in providing quality health care to most of the people. In fact, you would be surprised that almost 2.2 lakh people are added to the people who are suffering from chronic kidney disease and requiring dialysis. But most of these people are having an inaccess or not having proper means to maintain this disease in terms of not having access to dialysis and not also having access to quality health care and medications. So there are a lot of inequalities which we have to address at present so that people can have good quality medications and also quality health care which can be provided at their nearby places. Lot of people have to travel long distances, usually accompanied by someone, which leads to loss of man hours. So, internationally, globally, as well as regionally, most of the governments are now trying to provide quality health care at either their doorstep or at the nearest localities so that people do not have to travel much. In fact, our governments are also providing certain programs The Pradhan Mantri National Dialysis Program is being applied all across the country so that dialysis units are provided to the patients in the form of public-private partnerships, and people do not have to travel long distances. Certain governments are providing some kind of monetary support to these patients suffering from dialysis. Also, there are provisions for people who are below poverty line in which dialysis is provided either free of cost or at very affordable rates to these patients. There are also certain policies in terms of income tax which provides them relief from their income tax benefits so that these people can have savings and that money can be applied for their treatment. The medications also should be provided at affordable rates and people can have an access to buy them at a reasonable price so that their quality of life as well as their longevity is maintained. Apart from this, there are certain discrepancies in terms of healthcare providers and management. This also is being tried to overcome both internationally as well as in the regional levels by providing adequate education to people at the grassroots levels, people who are providing the primary health care, affordability of and availability of medications at primary health care centers will also go a long way in terms of providing quality health care to these people. The insurance sector should also contribute, especially for the patients who have this long-term chronic diseases. And there are certain policies which are being modified so that insurance coverage can be provided to more and more people. Hence, I would request that early evaluation and early treatment, especially for people who are at risk, people who are diabetic, people who are hypertensive, obese, people who have a history of having kidney disease in the family should also undergo regular evaluations, and early treatment strategies should be initiated if they are showing some early signs of development of kidney disease. So hopefully the theme of this year would go a long way in preventing the progression as well as slowing down the progression of kidney disease, which in the long run may have a long-term social, monetary, and even demographic consequences in the population of the country. Thank you. Namaskar.